Hospital. Welcome to Silver Hill Hospital Grand Rounds. We're excited for you that you've joined us today, and we'll get started in just a moment as people are entering their Zoom rooms on the internet that we're going to talk about today. All right. Welcome, everybody. Thank you for being here. I'm Dr. Jeff Katzman. I'm the Director of Education here at Silver Hill Hospital. I'm the director of our new Silver Hill Academy for Research and Education that we call SHARE. And we are delighted to have you join us today and very privileged to welcome Dr. Christine Miller, who will be presenting on a very timely topic of internet addiction. Some housekeeping, as always, to start. Our next Grand Rounds takes place on May 28th with Dr. Lawrence Fishman, who's going to talk to us on the topic of illusion and disillusionment, a Winnicottian framework for psychedelic assisted therapy. So that should be very, very interesting, and hope that you all can join us there and tell a friend. And to see all of our Silver Hill Share events, please visit silverhillhospital.org/calendar, and you can find them all there, including today's program. Back to today's lecture, your questions remain an important part of our Grand Rounds. I will moderate a Q&A discussion with Dr. Miller at the end of her lecture. This is a great opportunity to put forward questions and comments to Dr. Miller, which you can submit anytime during the lecture by using the Q&A link. If you can take any questions that might be clinical about a specific person or patient and maybe put those into a more general format, that'd be greatly appreciated for various reasons, such as HIPAA, and thank you in advance for that. If you'd like CME or CEU credits today, please complete the evaluation survey that will automatically show in your browser when we end the webinar. A link to the survey will also be emailed to all participants tomorrow. Note that this email will be a Zoom email coming from SHH Events. The email will also contain a link to the recording and slide presentation. So that all participants have enough time to complete the survey, it will remain open to the end of day on Friday. Certificates will then be emailed within a week. And as a reminder, only physicians may receive partial credits for the webinar based on the extent of their participation. All other participants must attend 100% of the activity to receive credits. Any questions about any of this, please contact us at SHH Events, all one word, SHH Events at silverhillhospital.org. Finally, disclosures. No planners of this activity have indicated a relevant financial relationship with an ACCME defined commercial interest, and Dr. Miller will show a slide with her disclosures as well. And now it is my great pleasure and honor to introduce our guest speaker today, Dr. Christine Miller. Dr. Miller's a psychiatrist specializing in integrative mental health care with a particular focus on addictions, women's behavioral health, and spirituality. Her journey into the field of internet addiction began serendipitously when, as a first-year psychiatry resident, she crossed paths with Dr. David Greenfield at a local Starbucks. Recognizing a shared passion, she sought out Dr. Greenfield as a mentor alongside other esteemed psychotherapy supervisors who nurtured her dedication to therapeutic work. After completing her residency, she joined Dr. Greenfield at the Healing Center in West Hartford, Connecticut, where she worked for quite a while, further refining her skills in psychotherapy. Currently, Dr. Miller practices at Indiana Health Group in Carmel, Indiana, where she integrates psychodynamic psychotherapy with medication management and serves as an independent medical evaluator for safety-sensitive roles. Her prior experience includes serving as clinical director of Greenbrook Recovery Center at St. Joseph Mercy Hospital in Ann Arbor, where she led substance use disorder treatment programs and contributed to system-wide improvements through an opioid task force. Before that, she worked at Waterbury Hospital's addiction program and emergency department, while also maintaining a private practice in West Hartford, Connecticut. Dr. Miller's holistic approach in patient care is enriched by her interest in yoga, positive psychology, and the intersection of mental health and spirituality, ensuring a compassionate and comprehensive treatment experience. I first met Dr. Miller at an APA conference where we both presented in Indiana, and she was so gracious to tell me that she likes to tune into our programs. And I sat down and listened to her presentation, and I thought to myself, really, wow, what an important area to integrate into our Grand Rounds programs. So thank you, Dr. Miller, for accepting the invitation to present today. It's great to see you again, and we just so greatly appreciate your being here today. And with that, I will now pass the baton over to you and then disappear until our Q&A time.
Okay, thank you. Thank you, Dr. Katzman, for that lovely introduction. And I will share my screen. We'll get started if that's working okay. So as Dr. Katzman said, I'm going to be talking about internet addiction. Obviously, this is not an official diagnosis, and with that in mind, we'll move forward. Let's see if I can forward. Okay, I have no disclosures. I'm very clinically focused, and don't work with any industries. Would like to dedicate my presentation, as I always try to the late Dr. David Greenfield. As was mentioned, he was my mentor and then partner, and he began his study and treatment of technology addiction in the 1990s and stayed working with it up until a year and a half ago. The goals and objectives, we'll be talking about different types of internet addiction and when possible, identify different unique aspects to each of them, learn, and then we'll talk about signs that you might see as a clinician or parent or community member, and then start looking at different treatment approaches and the evidence behind them. We're going to be trying really hard not to be judging social media and technology in terms of good and bad ethically, although obviously there is some growing consensus that the social media platform is decreasing a lot of the civility and increasing tribalization. These negative online behaviors are not necessarily indicative of addiction or an underlying disorder. So, there's a difference between spending too much time online and a disorder, and we'll be talking about, what makes it a disorder.
Hey, Dr. Miller, I was wondering if you want to put the slide icon at the bottom to make it full screen.
Oh yeah, I was trying to do that before, and I don't know how. Is it
That one, yeah.
this one?
Yeah.
Perfect. Thank
Yeah.
you.
Uh-huh.
Okay,
See you.
go through. Okay. I'm not very good at technology, kind of ironically at this point. And I hire people to do that if I need. So the prevalence with the internet, we all know it became more widely available in the 1990s, very new thing in our society. As of 2017, 87% of people in the United States had access. I'm sure it is almost up to 100% now. South Korea and China, their prevalence has been ahead of us. And with that, we also see an increase in prevalence in internet addiction. Studies by Zinn put their percentage more at 8 to 27%, but the general prevalence of internet addiction is, estimated to be around 2 to 15%, depending on which study you're looking at. So what makes the internet so alluring? I'm trying to find a way to make these all A words, but there's, first of all, the accessibility, obviously, everywhere and always open. The intensity and the stimulation that it provides um, is novel. There's a phenomenon called supernormal stimuli, which we also see in like animal populations. And it's when there's an exaggerated version of a stimulus that elicits a response that is stronger than what a natural stimulus would give. So, we also see this in the food industry, manipulations of like sugar, fat, and salt to make it more rewarding immediately. And the internet is certainly doing that with the images and whatever they're putting on there. It's novel and dynamic, always changing, always new, story without end, thanks to hyperlinks, just you can keep gathering more and more information. There is a time distortion that occurs when you're on it as part, dissociation. I know I've experienced it. I'm sure many other people have experienced it, where you go on and then for one thing, look up and it's a half hour, hour later, and that time has just been gone. So kind of a mindlessness can occur, or dissociation. It is a means of connection. Um, and we'll talk about this a little bit later, but it is a tempered and one step removed kind of connection, but connection nonetheless. There is a perceived anonymity, and I'm going to emphasize it's perceived. There are ways for people to figure out who you are, but with the sense of anonymity, people can have more fantasy play, and definitely more disinhibition is seen. People have a bit of an accelerated intimacy that it can occur because they're sharing more freely than they would if they were in person with someone that they're meeting maybe for the first time. The cost or affordability, and now especially thanks to advertisements, funding, most of the platforms, they are free for consumers or very low cost. There was a time not that long ago when water was free and you had to pay for porn. And it's very much the opposite now. There's instant gratification, and we know from other substances that are addictive or you can develop a dependence on, the shorter the latency, the more, or the shorter the latency into reward, the more addictive it is. There's an interactivity to the internet. So you are guiding and controlling the whole process. And then perhaps what makes it the most addictive in its form is this variable ratio reinforcement schedule, which leads many to consider computers and especially smartphones the world's smallest slot machine. So as you probably know, that this is how gambling ends up being so addictive, is the variability of the reward and the ratio to that. And it is the highest or the hardest to extinguish that that behavior. And then there's mastery, especially in adolescence. They can feel a sense of mastery on a game or a platform, and that's appealing to have. There's two more that I had only just added recently. One is the algorithms that the specific industries are most certainly using to target their users or consumers, to keep them engaged. And the other aspect is ambiguity. So technology and the technology platform is creating whole new arenas where right and wrong have yet to be defined, whether, in relationships or in cultures and societies. So, people are getting into gray areas where in the past it would have been a no-no for them. But, now they're kind of pushing into that. So while these aren't officially defined, I've defined these into 7 different forms. So there's the surfing or YouTube infotainment. Again, that's the hyperlinks, the like gathering more and more information from many different sources. It's very easy. And there's social media, um, the Instagram, TikTok, all of that, texting and emailing, pornography and cybersex, shopping, gaming, and gambling. Um, Many of these types of internet misuse do have addictive reflections in the real world. For example, Kreplin and Bluler did describe compulsive shopping disorder more than a century ago, while accounts of gambling or sex addiction are even older. And so the question, that we still need to answer is why not incorporate technology into already established behavioral addictions or compulsions? For some of these categories, that might be the best way to explain them. However, the digital intermediary can alter many fundamental aspects of the disorder. And what is clear is that the internet acts as the great accelerator. Um, there is a synergistic amplification of not only the content, but with the internet modality also being inherently addictive. So that might be why it's been a little bit difficult to pin down certain addictions and label them. Um, so first, we're going to look at Generation Z, which Dr. Greenfield and I also call Generation D. Given they are a very unique cohort in that they were the first generation to be raised on digital technology. They are digital natives, and other people have called them the guinea pig generation because we don't fully know what it's going to mean for them in the future and future generations. With adolescence being a time of identity development, and a lot of theirs is done through the sharing of information, of content. Another interesting thing about this generation is it's the first time there's been a real reversal of generational hierarchy in the area of power and knowledge, and this imbalance in families where the grown-ups no longer know more than the kids, which also makes it difficult, obviously, to set limits or to even know what you're talking about. They are talking and figuring everything out around you, for better or worse. And then if you see this picture, this is a real picture of people I know. And this was probably a Thanksgiving gathering or something. And this looks very much like parallel play, which is common in toddlers, but these are high school students. And I'm sure others have seen this, and you can go outside right now and look at a lunch table, and the kids, a lot of the time are not interacting with each other. Dr. Sherry Turkle, for the past 3 decades, has studied the psychology of human relationship with technology, especially in the realm of how people relate to computational objects. She has been a professor at MIT doing this work, and she had a really good article, if you want to look it up later, called Alone Together, which is very much what these kids are showing here. She also had a TED Talk, and she wrote a memoir more recently called Empathy Diaries. she's one of the ones who is really having the conversation about how the internet is a way to tightly titrate connection without risk. So be not too close, not too far away, kind of interpersonal connection. There is a lack of spontaneity in this, which in real life there would be. There's also a deficit in having to work through issues in real time. Kids can just sign out of a program and it's done. Um, so again, with adolescence being really important for identity development, there are a couple studies that do look at this in a very in-depth way, and propose the hypothesis that specify what kinds of digital context and experiences lead to healthy versus problematic mental health outcomes. Because for sure, it is not necessarily all negative. This table here is from the article by Perez Torres in 2024, and is a contextual perspective focusing on the role of social media and its influence on identity development. It was informed by research looking at aspects such as identification and role exploration, which is a task that adolescents have. And they are doing this on social media through expression of their interests and ideas about themselves. From that, then they would get some self-concept validation, and this is through the feedback, the likes, the comments, all of that. And another aspect that they're able to experience on here is exploration and commitment. So this is through exposure to different ideas, different role models. And if you can see in that third column, these can be positive or negative depending on, the feedback that they might be getting. More does need to be understood about this, and about the dynamics of these processes, because it is very dynamic. Also, we need to understand more about, the depth of the exploration that they're able to do, the maintenance or reconsideration of commitments to identity constructions. What does that look like and what does that mean for these adolescents? And the speed at which this is happening. They're being exposed to just many more ideas, many more lifestyles, and neither good nor bad. I'm not going to judge that, but it is most certainly creating an amplification of that process. So they're doing it much faster than I'm an elder millennial. I was still discovering new ideas and concepts well into my 20s. So that's, I'm definitely not going to label that as good or bad for them. It is relevant when it comes to setting meaningful limits with non-addicted and addicted alike. And I think it's important to discuss with adolescents and ourselves about what we are gaining or losing from these parasocial relationships. And by parasocial, I mean just because we know a lot about someone because of what they put on, say, their Instagram, do we really have a relationship with them? There is an opportunity cost to that, the amount of time that we're putting into those parasocial relationships. What are we giving up? So another reason to focus on adolescents and how internet is affecting them is because that is the perfect storm for addictions and risky behaviors. From a biological perspective, the development of the noradrenergic and dopamine reward system is like done or strong, which is leading kids to that powerful desire for fun and pleasure. The buffers to this system, the frontal executive areas of the brain and the inhibitory GABA system are lagging by 10 to 15 years. But in biological males, testosterone drives the desire and potential for taking risks and engaging in pleasurable and stimulating behaviors. Biological females have more of the estrogen fluctuation and correlates to increased risk for depression and therefore seeking comfort and pleasure through these escapism technology use. And so the other part is because there are different critical periods in here for our development, and imprinting and strengthening neural connections, similar to how we see individuals who start using alcohol before the age of 15 are much more likely, I think 3 to 4% more likely to have an alcohol use disorder in their mid-20s. We're also seeing kiddos who are engaging in uncertain platforms or forms of internet addiction developing into full addictions earlier and in a very problematic way. So the Monitoring the Future report, which has been going on for 40 years, has shown that illicit drugs other than marijuana or cannabis were at an all-time low. So the question is, are they replacing drugs with the smartphones in some ways? There's other thoughts about, because maybe if they're behind their screen, they're not getting out there and doing that real world experimentation either. Nora Volkow described it as an alternative reinforcer to drugs. And Dr. Silver Martins out of Columbia states that it's highly plausible that this is the case because it fulfills the necessity of sensation seeking and their need to seek novel activity, which we know teenagers have that. This was a cartoon I found recently in the New Yorker, and I think it speaks to many different aspects of technology. One, of course, being modeling, that, kids are hound dogs for hypocrisy. So if you are going to be asking a child to be pulling back or an adolescent to be pulling back on any of their technology use, technology boundaries within an entire household are also going to need to be addressed. With Generation D, not only did these kids grow up with technology themselves, they're the first generation to grow up with parents with their technology. And there are some reports showing that despite parents today spending more time with children, even with more women in the workforce, the emotional attunement is less between them. So in terms of attachment and modeling issues, there's several studies that are showing that moms on cell phones have children that are less resilient and more negative. And they did this with experiments with 7-month-olds, 2 years old, looking at their temperament and social engagement. And children often report that they feel unimportant and that they must compete for their parents' attention. And they feel sad, lonely, and mad when parents are on their cell phone. And distracted parental attention harms social and emotional development. It also harms learning. So, in another study, experiments done with mothers and toddlers that were interrupted during a learning task, those toddlers did not learn the new words that were, whereas those that had their parents' full attention were able to learn. Um, And these studies seem to put a lot of the pressure on moms. In my clinical experience, I have lots of moms coming in complaining about dads who are trying to pick up more of the parental load, but they're on their phone a lot of the time too. So it is certainly not just moms. Uh, I'm fairly positive it's a universal parenting thing. So the effects that internet addiction and excessive internet use on adolescents, there's studies that are showing that it is stunting their emotional and social development. There are disease states related to inactivity, cardiovascular, uh, obesity, um, probably vitamin D deficiency. And I'm in the north or states, so it seems like everyone has it. But and then of course, and really important is this sleep impairment. We know how important sleep is for everyone, but especially adolescents. And you know, they're on their phones well into the night, unless there's some restriction or rules around that. Um, And some kids can self-modulate that, but um, so other, studies are also looking at the how it might be changing their brain function. Um, and it seems like there's some abnormal functioning activity of brain regions associated with reliance on rewards. And two separate large-scale studies in Europe and Asia found associations between internet addiction and self-destructive and suicidal behaviors in adolescents. Um, the book by Jonathan Haidt, some of you might be familiar with, called The Anxious Generation. He puts together a very compelling argument for causation over correlation for these mental health issues that we're seeing in adolescence and young adulthood. Things like depression, anxiety, social phobia are pretty highly correlated. And what he shows in his book is it really spikes up after social media is and smartphones are ubiquitous. In terms of the etiology of internet addiction, there are many different models, and some of these are listed. Young's model, so Kimberly Young is another one of the clinicians and researchers who started around the 90s, and her information is largely around online infidelity. Number 3 here with Cooper, this was based on sexual compulsivity. And the idea was the access, affordability, and anonymity lead to this possibly becoming a problem. And then Greenfield's model tries to be a little bit more detailed, encompassing the neurobiologic and neurochemical factors, which are similar to other addictions. So the dopaminergic innervation, depletion, and then downregulation, leading to a lower hedonic tone. And the social factors, where it's a place where there can be a virtual rehearsal of social competence, And then there's the accessibility factors and of course the variable ratio reinforcement schedule. And Deirdre Barrett speaks a lot about the supernormal stimuli, which I mentioned before, where our primal urges, which are driven by a dopamine system and our survival drives, they are overrun, and they are being hijacked because of the content being so much more appealing, and the reward being higher, because of the latency or the intensity of the visual cue that someone is getting. As with other addictions, this leads to, the chronic hitting of that dopamine lever is going to result in a downregulation. And then, this is the traditional cycle of addiction, which we do see in internet addiction as well. FASAM did in 2011 propose for the first time that addiction is not limited to substance use. And in their new definition, it is chronic and relapsing and can be with behaviors or compulsions. So we can put this on to any of those types of internet addiction that I mentioned. And this is more of talking about that. So how it works. I don't think I will go into reviewing that, but it really is the basic model of addiction with binge intoxication, dopamine affecting the systems, and eventually it drives into the not having a choice of doing it. So it becomes from impulsive to compulsive. And there is withdrawal that is seen with this, mostly with the low hedonic tone. Another book I have, and it'll be recommended at the end too, is Dopamine Nation, which talks about this in many aspects, but certainly also the internet platforms, how that is triggering this addiction pathway. We'll see a little bit later stuff on this as well. So the reward deficiency syndrome, I first really started hearing and knowing about this through the work in the opiate use disorder realm, with the medication-assisted treatment being a great option for people who might have this, being a safe level of engagement to increase the dopamine. But there's also some question, is this also setting up people for that internet addiction, that's seeking the reward pathways? And so I won't go too much into that. A lot of these first studies happening in the early 2010s are specifically about internet gaming, that was showing to be very problematic, especially in Asian countries, where they had internet sooner, they had a lot more access to these internet gaming. They had internet gaming cafes, and it was becoming very, very problematic for some people. So Dong has done a lot of research, several different research studies, um, and the changes that we're seeing on fMRI, we're suggesting diminished efficacy of response inhibition, and they suggest enhanced reward sensitivity and decreased loss sensitivity. I think it's important to note that this is in gaming because that's not what's seen in gambling. Um, and then there was also less efficient processing and lower impulse control. Throughout all of the types, problems with impulse control and worsening of impulse control is hallmark. So these are more studies for this. Internet gaming, there are a lot of them. I just pulled some of the ones with more strong evidence. And interestingly, there's, especially in adolescence, there's delayed development in several regions of the brain related to executive function, as well as problems with self-awareness. And there are cases when, because of this, people or adolescents who were involved in these online games where you get to create these avatars, they are identifying more with the avatar than their real life self. And so, and this last one kind of shows some of that these changes that are seen are what link it to and suggest that internet addiction could be affecting identity formation. Again, this is with gaming specifically. It's not clear if things like social media or gambling would have that same effect. This is from one of those studies just showing the differences in functional connectivity between healthy controlled substance and those with internet game addiction. For all of those details, you can look at the previous slides. And this is just more of the same. There are a lot of studies on internet gaming. So interestingly, looking at the default mode network and the inhibitory control network in internet addiction, you can see a correlation between the deactivation in the default mode network and worsening symptoms. And the inhibitory control network correlation suggesting reasons for difficulty stopping or controlling overuse. Much like with other addictions or use disorders, we talk about, how are you able to control how much you're using? Can you stop when you want to stop? The same things apply for internet addiction, and these are, again, seen on fMRI. We can see that is occurring in internet addiction, internet gaming addiction, for this one. There's other studies I linked here if you do want to read more about that. TLDR, long-term changes in gray and white matter volume in brain regions associated with memory, attention, impulse control, emotional regulation, and motor function are all seen and pretty well established. This speaks a little bit to the dopamine deficiency syndrome. So again, it's not clear if it's causal or leads to addiction or is caused by the overuse. So this is showing the reduced D2 receptors availability in the areas that are indicated with addiction, like the striatum, caudate, and putamen. This is very similar to other substance use disorders. A study shows that the D2 receptors in the ventral and dorsal striata were occupied during gaming, similar to that following amphetamine injections. So to say that internet use is not affecting the dopamine system or creating some reward, playing with the reward system is not true. It absolutely is. And so this is kind of showing the same thing in a different way. Cognitive control, executive function, motivation, and reward are all being affected by the internet usage, and especially problematic usage. Hormonal effects, I think, are very interesting. Texting, so the written word compared to audio communication, shows differences in hormonal effects. So oxytocin was lower and cortisol elevated at the same level as those that did not interact with parents. So that was when just texting was done. And this is during a study. Actually, I'll go in and explain the study a little bit more because I think it's very interesting. So this was with female adolescents who had undergone a stressful event. The ones that had texted with their mothers after undergoing that event did not have a lowering of their cortisol or a raising of their oxytocin. But children that were able to interact with their mothers in person or over the phone had that oxytocin increase and a lowering of their cortisol. So, and I see this in practice when a kid is going through something stressful at school, they have their phone and they're able to they're texting their mom and mom is texting back, and it is not helping, and so it goes on for hours and mom or dad are, distracted, pulled away from their work, whatever, trying to help this crisis, not crisis, but definitely stressful event for the kid. And the kid is not getting any relief or finding other coping skills. So kind of continuing on with the oxytocin, there in other substance use disorders, as well as ADHD, autism spectrum disorders, we're seeing a genetic variance in the oxytocin receptor gene. This correlates with lower empathy and expressiveness. There's a very good study by Core from 2022 showing that the oxytocin to vasopressin ratio in problematic porn use is linked to lower empathy and more severe psychologic symptoms. Now, kids will often argue that their gaming helps them, and it does help certain aspects. They can improve attention and conflict resolution with visual cues. I'm sorry about the dogs. I don't know if you can hear the dogs, but okay, I'm going to keep going. Better ability to track objects. They're really using their eyes and their fingers, and those are getting pretty strong connected. They have more efficient parietal lobe and orienting attention, the frontal lobe, sustaining attention, and anterior cingulate, controlling attention and resolving conflict. This is really a hyper focus that they are getting good at. And sometimes this is being harnessed in our field with in a positive way, certainly. And I think there's more that will be revealed about how we can use this to our benefit. But it certainly is not all benefit. This slide, we're really talking about neuroimaging studies. This is a great overview article. I'm trying to be mindful of the time here. Okay, so this is going over more of internet and gaming addiction. I'm gonna move a little bit quicker. So I want to talk about gambling. This area, I believe, is going to be a big problem, and we can look at places like the UK and Australia, which opened up sports betting sooner than we did, and there's definite consequences, and they're working on legislation and things like that to help. For the United States, it opened up in 2018 for this online sports betting and gambling. In the past, casinos and sports books knew their clients personally, and they have largely been caught off guard because they were not prepared for the kind of personal information that online platforms would be able to leverage to prey on people. The industry is targeting people with limitless advertising, free things, free gambling. Here's, $20, come gamble with us. And they are also evading age restrictions by framing gambling as sweepstakes. So even though it's not legal for kids underage, kids are doing it through other, channels that are considered sweepstakes. It is a predatory industry where young women have been impacted negatively by social media, and that whole platform has been bad for their mental health. Young men are at the most risk for the gambling online. And those who start on sports betting become addicts. And I use the word addicts, use disorder, but they become addicts at a rate of 8%. Okay, but how many are doing it, right? Over 60% of boys on campuses, college campuses, are sports betting. And this is occurring in high schools as well. There are gambling rings in high schools. It is absolutely happening. So it has the same allure as the internet, being it's accessible. And what's different from in real life gambling, traditionally in real life gambling would be episodic. It'd be a trip to the casino, and then there'd be a break from it. But now it is 24/7 access. It can be done much more secretively because of that, it being just on your smartphone. It's not like you've disappeared for 24 hours at the casino and have to come back. You could be a person could be laying in bed with their partner and engaging with this, and the person would have no idea. Again, with the marketing, the industry has invested in sports books over traditional games, and they are trying to gather their users and their consumers of it. And there are very few restrictions on them. Um, the low barriers to engage, financial industries are also involved in this, making it easier to get the money to bet and lose. And so, the same rule does apply with gambling and this is what makes it somewhat different from the other addictions, is that gamblers historically, um, and we see it here, is they're chasing the loss. They're always trying to get even. Um, and they have more neurobiologic sensitivity to losses over gains. I have been seeing a lot more gamblers lately in my practice, and in some ways, I really try and get them to see they're not good at it. They are losing, um, and they do get to that place where they recognize, the house always wins. That is true. Um, if you were winning, also what's happening on these sports books, if they know that you actually know what you're doing, they will kick you off immediately. So they are using adverse selection to only keep users who are going to lose in the long run. So again, with gambling, when I see clients with this, I'm really trying to educate them on that and the statistics. And so again, this is some data since the Supreme Court overruled the Murphy v. NCAA, which opened up states to having sports books. Prior to that, it was only Nevada. By 2024, 38 states had it. And this is a look at the wagers that it went from about $5 billion to $121 billion worth of wagers. 94% of those wagers were placed online. In the study by Yola, it was published very, very recently in JAMA. They were just looking at, the prevalence of online searches for gambling addiction, and there was a huge surge, and it would just increase as states were adding on, and the states that added on sooner had more. Kind of a non sequitur. Now moving to porn versus sex addiction, and this would be porn and cyber sex. So there are some unique differences, and you can see here that people who have more of a porn addiction, they are seeking the pixels and the searching, they're finding new things, new exciting things for them and the visual novelty, whereas sex addicts, they're looking for novel partners and are engaging in more behaviors like voyeurism, flashing, footage. Usually the online activity does not spill over to other sexual activity in real life, whereas sex addiction, risky behaviors are very common. When asked, people who have porn addiction say they would like a steady partner, a relationship, that intimacy. With sex addiction, they are looking for the novelty of different partners or different activities. In porn addiction, we are seeing a lot of ED and low libido in real life, and that doesn't occur in sex addiction. The prevalence is increasing due to the access in adolescence, and we're having issues with that in young men. Other aspects or characteristics of those with sex addiction that it doesn't ring true for a porn or cyber sex addiction is a higher rate of homo and bisexuality, There is a higher rate of sexually transmitted diseases because they are engaging with other people. And historically, there's more sexual trauma in their past. We're not seeing that in the porn addiction. Um, Another aspect I didn't add here was with porn addiction and cyber sex addiction. Um, there is the ambiguity of, is it right? Is it wrong? Is looking at porn infidelity? Relationships are strained because of this and really need to define it. Um, and um, they have to define the infidelity in real life as well as online. What would each partner define as infidelity? Chatting with people, watching people perform acts, where is that line for each couple? And so this is a very good study looking at the neurobiology in porn usage. And really what these changes point to is or suggest is that there is tolerance and desensitization. And because of that, that's where we see the downregulation of the natural neural responses to sexual stimuli in real life. So again, the low libido and the erectile dysfunction because the person in the room with you doesn't look like the person on the screen. The dorsolateral prefrontal cortex affects executive function, is also associated with cue reactivity to internet porn and can be interpreted as a sign of impaired cognitive control. And this is important for several reasons. With the sexual arousal is designed to block logic and your better judgment. Because at one time, evolutionarily, it was in our best interest to not be paying attention to all those things when we're engaging in a procreative act. In how this becomes a problem is when people start crossing legal lines because they're not thinking more rationally, thinking about the consequences. They're kind of just seeking to engage. Legal issues almost always arise from an escalation in addiction in the form of seeking more and more stimulating online sexual content. And in my experience too, and studies have shown this, that the perpetrator rarely sees how the consumption of illegal pornography negatively impacts others. They feel like it's a victimless crime, and they are really detached from the person on the other side of the screen. They are people who are addicted to porn really are engaging for that online dissociation, which means the psychology is quite different from in real life, where they are actually trying to engage and connect and not dissociate. Okay. And it should also be noted that the illegal online activity with underage or bestiality or things like that, it does not correlate to real world activity. So if someone gets in trouble for this online behavior because they're so detached from the person on the other side, it doesn't mean that they're going to be engaging with underage people in their real life for the most part. Okay. This is a very old cartoon. I just put it in for a little break. Um, and I want to I'm gonna have to go through a little bit more quickly here. So it was in 2019, the WHO put gaming disorder as a mental illness in ICD-11. We are far behind on getting these other ones defined. This is the proposed criteria, which they based off of a lot based off of the gambling disorder criteria. So preoccupation, experiencing withdrawal, developing tolerance, loss of control, continued use, mislead others. And I underline that one. I think it's really important. Have they deceived family members, therapists, or others regarding the amount of time they've spent gaming? Um, you know, using that as an escape and everything else. Because there is such a time distortion, a lot of times they are not even aware of how much time they're spending online, not just with gaming, but with all of the forms. And sometimes I will just have them hand me their phone. So give me your phone. I'm not going to do anything to it. I'm just going to look at your screen time really and just go through and really look at it. Um, so the cognitive and psychological symptoms that you will see, there's a lot of denial, rationalization, distortion, as with any addiction. Um, we're seeing anger, depression, and anxiety. Um, and okay, so then the behavioral symptoms, let's see, gets more on psychological symptoms. I think what's interesting is there are some predictive factors for social media addiction in personality characteristics. These include if someone has a tendency to have more FOMO, and they measured this, they're more likely to have get looped into social media addiction. Those that are more extroverted, and then lower scores in empathic concern and perspective taking. And I think this has to do with kind of that tribalism that we're talking about, like people who have a harder time seeing that there's maybe more than one side to an issue or a story than what is presented. They're also more likely to fall into problematic social media addiction. As we know, and I think this is more on the cognitive side, people are going to be saying, oh, I'm multitasking, it's okay. And we know that multitasking is a myth, and we can educate them on that. So the behavioral symptoms we're seeing is the shortened attention span, seeking instant gratification, being distracted, sedentary lifestyle, social withdrawal, the in real life social withdrawal. They might be quite social online, but not doing anything outside of it. Of course, legal issues can occur with the gambling and cyber sex or pornography if it escalates to that place. And there's the functional impairment with decreased academic or work productivity. The physical symptoms that obviously there are changes that are documented that are happening in the brain. For pornography, there's a sexual desensitization and erectile dysfunction, obesity, and a lot of this was more happening in Asia, but people were sitting for so long, they were getting DVTs and blood clots. People are getting repetitive motion injuries. There's something called tech neck from looking down, so having like the neck issues. And then, of course, sleep and circadian rhythm disruption, blue light, as well as the stimulation of the content is keeping people up. This, I just think, is a very interesting slide showing, for every minute, where is the time going? This is the the cost that um, that occurs with online use. So this is a internet addiction test by Kimberly Young. I mentioned she's been doing this since the 90s as well. And on a scale of 0 to 5, you have people rate this. And then here's um, the outcome saying like, oh, you might have a problem, or this might be impacting your life. People often ask what are the comorbid disorders, anxiety disorders, especially OCD and social anxiety. The depressive disorders, it's questionable, as with other substance use disorders. Is it premorbid or is it reactive? Was it a self-medication or a solution that they were finding for their depression, or is it the consequences of it are causing depression? Learning disorders and autism spectrum disorders seem to index higher for having internet addiction, as well as ADHD, and especially if I see someone with internet gaming disorder, they probably have ADHD. So this is kind of about that it really, because impulse control disorder is very correlated. There's a lot of impulsivity. I think there's also like the games are designed to keep people engaged. Someone with ADHD is hyper focused on it. They're improving, they're mastering. The gamification is really keeping them engaged in a way that reading a book is not going to. So in terms of treatment, the people are brought in usually are not brought in of their own accord, similar to substance use disorder. So always starting with motivational interviewing and helping them find the motivation to look at their behaviors. Psychological versus pharmacological treatment. Really, it is psychological treatment is more effective than pharmacologic treatment. And there's evidence out there for many of the different ways of doing it. So CBT, ACT, exercise-based interventions. The treatment model that Dr. Greenfield and I use, really getting a lot of background, addressing underlying psychiatric issues, always being curious and non-judgmental, knowing that this is some reason they're doing it, something about it was working for them. And in treatment, our tasks, we're always thinking about educating them, a lot of education about what is really happening in their brain, in their body. I do a lot of education about, that they're being targeted, they're being marketed to. Let's pay attention to that. Let's not let them essentially control us with their things so they can make money off of us and all of that. Like I think once, because they feel like they have control and that this is something I'm doing and I'm choosing. Just because it's not what your parents want you to do doesn't mean you're choosing. I don't do it, but some people use EMDR. Obviously learning to identify triggers and cues and avoid them or have plans for them. And a lot of treatment is on kind of like setting up limits and blocking, the same way we would say get the alcohol out of the house. It's how can we set up boundaries on the devices. And I have some resources at the end with some specifics of that. because there can be such a social withdrawal or social lack of development, depending on how old they are when they're coming into this issue. Really, we try and spend a lot of time addressing the social, vocational, and relational aspects and really helping them to get back into real life activities, help them discover activities they like, and will provide more sustainable, pleasurable experiences. That's what the real-time 100 list is. I get them just trying things. Um, Easier said than done, but it is a process. Um, and then because the internet is not something that people can be off of completely, discussing abstinence, defining what that means for people, and determining if moderate use is an option. In terms of pharmacologic treatments, mood stabilizers are not well studied. I will say a lot of people coming in with the gambling addiction look very bipolar. And so sometimes using mood stabilizer just, to calm things down a little bit. Antidepressants, SSRIs, especially if there's underlying OCD or social anxiety, and psychostimulants for concomitant ADHD. Bupropion shows some promise and is used in gambling, or shows some promise with gambling as well. So for gaming, naltrexone might be helpful. Topiramate, there's studies showing it might be helpful to decrease compulsive sexual behaviors in shopping, and possibly N-acetylcysteine as an option. Again, none of these are FDA approved. And these are the resources. I think it's important. The gambling blocks, there are ones that were already around for banning people from physical casinos. These are other ones that each has their own benefits and downfalls, but this can help prevent that sports book betting. Covenant Eyes is a program that helps block sexual content. And the bottom ones have to do with parental controls, and I'm sure there's more out there that I don't even know. Treatment there's not a lot of treatment out there for this specific, probably because it's not fully defined, but here are some places that one can look into. And these are other recommendations that I think I mentioned most of these in the talk. And thank you for letting me present this, and we'll take questions if we have time.
We do. And folks have questions, please go ahead and put those in the Q&A section, and we'll try to get to what we can. Dr. Miller, thank you for so much knowledge that you have packed into one presentation. It's really kind of remarkable to me in such a growing problem that I think for all of us that are a little older, raising younger younger people, it is hard to get our heads around actually the depth of this. I'm wondering a bit about, you alluded to this a little bit, about kind of one addiction when treated, can impulses or anxiety related to that, say with bulimia or other impulse disorders or substance use, then lead to internet addiction. What do you see
Meaning
with
like
that?
cross addiction
Yeah,
kind of,
or the treatment of
or
one, then
whack-a-mole
in this,
kind of.
yeah. Do you see that in
Yeah.
practice?
Yes. And absolutely. Um, yeah, yeah. I mean, it just does. I'm thinking about people often with like cocaine or alcohol, then they will, end up in the gambling area, and a lot of times they will actually be going on at the same time. So sometimes it's about like you can't address one without addressing the other one too, or they do ping pong. Um,
Great. I'm
yeah.
going to pick some key questions here in our last 10 minutes. Can uh, can you give some suggestions about, Dr. Miller, about the best approach regarding screen time for young children and how to think about that?
Yeah, I usually just look up what the Pediatric Society is saying at the time and that it is changing. I guess it depends on the age too. I think, um, 20 to 30 minutes a day, um, is generally okay, but, um, again, what are they not doing because they're doing that? Is there, um, it's hard to say because each kid is different and what do they need? And what are they doing on the screen? Are they doing an educational program or watching a show? I advise more against those kind of YouTube or interact where they get to just like keep looking and looking and looking for the video they want. That to me is more problematic because it leads to that like seeking something that excites them more. Like kids need to learn how to sit and like maybe not love something for 5 minutes to get to the reward, you know.
And again to the intergenerational issue, or not internet or difference in knowledge. What do you advise parents about how much they should be tracking or knowing about what their kids are doing online? Like how much should they be hovering and involved with their activity and knowledge? I think something happens and then they feel I should have known, but what's the right approach in terms of parenting a child these days?
I think for younger kids, say grade school, I think you should know what they're doing. Like they shouldn't be alone doing it, unfettered access. Most important, I think, is having the parental controls on everything that you possibly can and adjusting them with the age. Um, because they're going to explore and that's okay, but you don't know where that can lead unless you've made some real limits on it.
Great.
So, yeah.
Question here about taking technology away from an adolescent as a consequence, and specifically the downside of doing that, considering how much of a lifeline this can be for youth. This person's thinking about court orders in juvenile court settings, for example, that might be unrealistic. What do you think about that?
Um, so I don't think we do that in Indiana, so I don't have a lot of experience with it. The consequences, I think any consequences of the kid need to make sense for the crime or, the thing they did wrong. So if um, the phone or the internet was where the negative behavior happened, then it makes sense to remove it. Um, I didn't get to talk about this, but because of the withdrawal and the emotional dysregulation that can happen, always want to have a plan before you do it, and because you can really escalate a situation behaviorally. There's cases of violence and all of that, or suicidal threats and things like that. So you really want to have a good plan in place with the treatment provider about, when is the time? Are there things set up so the kid can stay safe? Um, yeah, so I don't know if that answers the question, except for yes, they do use it to connect, but it is not the only way to connect. Um, and if it is like they're worried about not being able to connect with some of their online social people, do they need to tell them in advance? Do we give the kids the respect of saying, communicating with their online peers, hey, I'm not going to be available for a little bit, um, and saying their goodbyes.
Yeah, nice, nice. Do you have a question here? Do you have any thoughts about how to work with nonverbal autistic youth who are internet addicted?
Oof, no, I don't. I
Mhm.
don't. I mean, yeah, that's a hard one because again, it's an area where they're probably mastering and feeling pretty competent in a world where they don't have that. Um, just off the top of my head, I would think about again setting the limits. If they're internet addicted, that means there's some kind of consequences happening. So is it they're losing money? Is it they're not moving around enough and getting physical activity? So making sure that there are limits so that they're getting the other healthy behaviors too. Um, but obviously they're depending on their emotional regulation and how much they're going to fight it. Yeah.
Dr. Miller, there is a question here. You talked about the focus provided from online gaming that youth can experience and alluded to this a little bit. But there's a question, do you have thoughts about children and adolescents receiving mental health treatment protocols that utilize virtual reality or gaming platforms or approaches? And are there costs or benefits to those approaches that you think about?
I Yeah, I do think about it because I think I read Dopamine Nation, which really affected how I think about things. And I think this is happening in our schools too. Education is getting gamified and, it is this like, ooh, look how exciting. We're all adults. We know that it is not that exciting all the time. And so the gamification of things, perhaps if it's a treatment approach, that's okay because maybe not a treatment approach for internet addiction, but a treatment approach for something else. Yeah, because the treatment it maybe benefits outweigh the risks. Um, in general, I'm hoping that we do less gamification to motivate our children out there.
Great. And to that comes a question, what advice would you give parents about how to encourage their children to engage in other activities other than mirroring or engaging themselves, such that parents reading and their children reading because they do? Um,
Yeah, I mean, I think as parents, we still have control a little bit of like just not giving them access and then letting them figure out what other activities they want to do if they can't be on a screen. Like, not every kid's going to be into sports, but if you give them opportunities to be creative and find what they like off of a screen, um, and certainly the younger the better. I have younger kids and it is, here's your time limit. When it's over, it's over. There's no exception. So, and the computer, the devices are set like that. So it's not an argument. They know I'm going to set the device, but it's just like, nope, that's your time. Okay, go figure out something to do. I don't care what it is. Well, I don't care what it is. Let them be creative and explore and find on their own. Yeah.
this is a continuation of an earlier question. Uh, can you give some recommendation about screen time for high school age uh, youth? Please, there's a need for guidelines and how to implement it due to the heavy reliance on the use of screens for completing homework assignments. So how do you approach that for kids in high school?
Yeah. So, and because the homework is done online, I think that's really difficult to say. I usually, instead of saying overall time, because they're fitting it in after school and then it's bedtime, is more of like a cutoff time. So, you know, no screens after 9 o'clock. And if you didn't get, or yeah, 9-ish. we kind of figure out what their schedule is, but then, okay, and then have the parents have the conversation, well, why aren't you getting your work done? If it's not getting done, if it is truly homework. Um, so helping them, I think we always want to help them come up with the solution, the kids. And so putting that barrier up and again, protecting their sleep. Kids are always gonna make choices of, am I gonna do my schoolwork or am I gonna do something else? And um, but if we remove the lure of screens and internet after a reasonable time, then it's kind of forcing choice.
Hey, thank you. Thank you, Dr. Miller. The questions keep rolling in, and I can't
Okay.
get all of them. But thank you, everybody, for being here. Thank you, Dr. Miller, for your really, as I said, jam-packed presentation with so much information. And thanks to everyone for joining us today and for being part of our learning community. As a reminder, for those wishing to receive continuing education credits, please complete the evaluation survey that will automatically show in the browser as we end the webinar. And we hope you can join us again on May 28th. For now, thank you. Thank you, Dr. Miller. And we've been connected on the internet, and now we'll be
Yeah.
alone in our rooms. So kind of
Okay.
here comes the transition and putting down our devices and getting back to our lives. So thanks again. It's great to see you. And thanks everyone
Nice to
for
see
being
you
here.
too.
Bye.
Thanks.